Okay, hello everyone and welcome to Cracking the UCAT Code, a deep dive into verbal reasoning and decision making. So I'm just going to start off with a little bit of an introduction about me, just so you know a little bit more about me and the person who's teaching you. So my name's Catherine. I currently attend Newcastle Medical School and I'm in fourth year, completing my elective currently, and I'm about to start fifth year this coming September. So I currently have interest in breast surgery and plastic surgery. They're the placements I've enjoyed the most. At the minute, the surgeries that I found the most interesting, and I've known for quite a while that I want to pursue a career in surgery. I'm currently doing breast surgery now, and I think it is swerving me a little bit that way. So I do actually have a greater interest in breast surgery at the minute. So I'm tutoring for 6 months for the past 2 years, and I tutor in the UCAT crash course. I tutor a lot of UCAT, and I tutor a lot of interviews, which hopefully you guys will be getting, and I'll be seeing some of you in the future. So in the year I did the UCAT, which was 2018, on the 11th of August 2018 actually, I scored 3,180, which was the top decile for that year. So just general top tips of the UCAT: practice questions, then do technique, and do technique first and then do your timing. There's no point doing timing straight away when you don't have the technique quite mastered. Practice questions are so useful. Doing as many of them gets you used to sort of layout of the exam, sort of things that might come up. Hence why I would say practice questions quite a lot. Do little and often. You don't have to sit in front of your computer for 5-6 hours just doing the UCAT. It's better to break it up into little bits and do it quite often. High retainment, and it will do you better in the long run. So practice with software / the computer. So we've got UCAT Ninja, which we use. Currently, that's £1. And practice with a computer, I tend to sway away from practicing with books because it's not quite exactly the same as it is in the exam when using a computer, and you have to get to know the shortcut keys like Alt and N is next, and Alt and C is calculator. So try practicing with a computer if you do have one, or maybe go to your local library if you don't have one. And don't get overly stressed with the concepts and technique. As you practice, this will get better. So don't get overly stressed with that. So with the UCAT, this layout every year starts off with verbal reasoning, then goes to decision making, then quantitative reasoning, abstract reasoning, and lastly, rounding off with SJT. So this is the exam breakdown, and I know it doesn't look like a lot of time. VR, you got 21 minutes, decision making, 31 minutes, quantitative reasoning, 25 minutes, abstract reasoning, 12 minutes, situational judgment, 26 minutes. It isn't a long time, but it is a 2-hour exam, and I will be honest, it absolutely flies by. So working it out with the minutes and the questions, you've got in the third column the number of seconds you would have per question, which also doesn't look like a lot. So another top tip I would have is that if you don't understand a question, just flag and skip it, because along the line, there's definitely going to be easier questions that you can access. And you'll have, if you do that, flag and skip and then come back, you will have time to come back to it. If you flag and skip and come back to it though, do make sure that when you originally flag and skip it, that you do put A, B, C, or D. Because if you don't have time to come back to it, then you've lost that mark straight away just because you haven't actually put an answer. So each section for the first 4 scored 300 to 900, 900 being the best score and 300 being the worst. And SJT is scored bands 1 to 4. So most unis don't actually look at whether you're in a specific band for the SJT. They just want you to be in bands 1 to 3. However, do check this with the unis that you're interested in applying to, just to make sure on that. So start off with verbal reasoning. There's 11 passages in verbal reasoning, and there's about 4 questions on each passage. There's 44 questions in 21 minutes, so 28 seconds per question, as we discussed originally. Why do we do it? So reading passages of information and coming up with logical conclusions will come up all the time in your medical career. Continual learning throughout the whole of your career, real life scenarios and patient notes. Some patients' notes are so long that you do have to skim it. It would take so long to read every single sentence. You have to skim, pick out the important information, utilize that in order to make the best decision with your patient. You need to have good problem solving skills for diagnosis and research. So verbal reasoning. It assesses your ability to read and understand passages of text quickly and decide whether set conclusions can be made from the text. It's looking for you to identify incorrect and unsupported statements, and timing is very strict. And many people struggle with this section, not just solely because of timing, but because it is the first section on the paper. So it is the one that people tend to do worse at, just because your adrenaline is at an all-time high. So what type of questions can you get? So you can get true, false, can't tell. You can get single best answer questions. So true, false, can't tell would just ask you to tell you whether the statement is true, false, or you can't tell from the passage. And the single best answer is sort of phrases, which one is most likely to be right and which one is most likely to be false. So approach your verbal reasoning. You read the statement, firstly, you identify the keywords in the statement, you find the keywords in the text, you answer the question, scan the passage and scan the passage well, and flag, skip, and return later if you don't understand. So identifying keywords. What do I mean by keywords? What sort of keywords are we looking for? So I say things like 1912 or names, or so years, names are really good keywords to identify in the text. You should be able to find them quite easily. And when I say scan the passage well, what do I mean? Well, you find the keyword, you read that statement, and yeah, okay, it might agree with the statement that you're looking at. But if you read the sentence before or after, it actually might contradict it. So scan the passage well, read the sentence before and after, just to make sure there's no contradiction, and then put your answer. And obviously flag, skip, and return later if you don't understand. So the strategy for true or false. So evaluate the statement, scrutinize the language used, and be careful of certain words such as always, which may change the meaning of the statement. Locate keywords and check context. Find keywords in the question and locate them in the passage. Try and use multiple keywords to help you. Compare and judge. Read the sentences around those based on the keywords to check the context. And discard and decide. Immediately discard wrong answers and double check that that passage completely agrees with the statement. And decide if you prefer reading the passage first. So some people do prefer reading the passage first. They find that helps them. I would recommend reading the statement first and then going to the passage, because you're probably going to have to reread the passage anyway if you read it first. But if you find that is your preferred way, then do it, because at the end of the day, the aim is to get the highest score possible. It's not to do what everyone else around you is doing. You need to adapt it to your own learning skills. So never assume information. We all know that the Titanic sank in 1912, but if a statement came up saying the Titanic sank in 1912, you put true because you know that. But if it's not said in a statement, then it's probably can't tell. So don't use your own knowledge to sort of answer the questions. And flag questions if needed. It's not a disadvantage of flagging questions. It doesn't mean anything. You just can't understand it at that given moment in time, and you just need a bit more time to be able to think about it, and you come back to it. Often when you do flag the question and come back to it, you find that it goes a little bit easier with the verbal reasoning section, especially because you're a little bit calmer as you've got further through the exam. So the single best answer, that's about picking the answer that best fits with the passage. So strategy, assess the question, look at keywords and assess if any of the answers are automatically true or false. Check to see if any cannot be backed up. Evaluate the statement, locate keywords and check the context. Compare and judge, discard and decide. Double read the question and check your answer. Do not just choose the true answer. The question might actually ask for the false one. So just double check the question. And you can use diagrams and tables if this helps you to work out the answer. And like I've already said, do flag and skip questions. So general strategies, be aware that different sets will require different timings. So be as fast as you can. It's easy for me to say to be as fast as you can, but I think in this particular section, it is important to be particularly fast because your adrenaline, like I've said 3 times already, is at an all-time high. So you can get distracted and spend a lot of time on different questions. Just keep an eye on that time in the top corner and you should be fine. Different sets will require different times anyway, because some are hard and some are easier to access. So it will require different times in that. So there's a timer in the top corner of the screen. So check where you are at the halfway point. You want to be halfway through the questions as a minimum at the halfway point, unless you might not actually have time to go back and check. Don't overthink. This is the same for my exams in medical school. So we do single best answer for medical school. Our lecturers told us that when you tend to go back, when you've answered a question already and you know the answer, and you tend to go back and you change the answer, you tend to get it wrong. So don't overthink. If you find the answer, then it's fine. Move on to the next question. And discard without hesitation. Just get rid of it if you think it's the wrong answer. And avoid spending ages on difficult questions. There are difficult questions. Flag skip. Yes, move on. General strategies. If you aren't sure on the true or false questions, then the answer is likely can't tell, because it probably isn't in the passage. So look for answers that reword the passage as well. Look for synonyms of your keywords, check quantifiers, check for supporting evidence, for example, sample size, and practice skimming and speed reading. So use a pointer, stand back, just practice in life. How can you just practice in life? News articles, BBC News. You can use newspapers, you can use just books, textbooks that you're revising A-level, just practice in life. So like I said before, don't use your own knowledge and avoid making assumptions in the absence of information. Practice speed reading, useful. That is very useful for medicine in general. Some people prefer to start with questions, others start with a passage. Practice both, see what works for you. Have a system and eliminate obvious incorrect answers. So I'll give a bit of time to see this question. Yeah, so the answer to this question is true. It says that they're made up of many harmonically related frequency components. Question 2. Okay, so this one is false. It does say in the bottom paragraph that it's a single harmonic partial. Anyway, now moving on to decision making. So decision making assesses your ability to apply logic to reach decisions and evaluate arguments. So knowledge of specific maths and logic is not needed. You may be presented with questions that refer to text, diagrams, or graphs. And you get marks for correct answers and partially correct answers. So if you get 3 out of 4, you will get marks for that. It's when you get 2 out of 4 or 1 out of 4 that you won't get a mark. So why do we do it? It tests evaluating arguments using deductive reasoning and interpreting statistics and figures. You need to decide on logical conclusions and strongest arguments in everyday life as a medical doctor or as a dentist, because I assume some of you will be doing dentistry as well. Also, we'll be asked to interpret data sets. Doctors frequently encounter complex scenarios which require quick and accurate problem solving. And it was designed to replace the easier previous decision-making section in 2017. So decision-making is 32 minutes in total. Get 1 minute for your instructions and 31 minutes complete. 29 questions in total, with some having multiple parts. And there's 6 question types: syllogisms, logic puzzles, interpreting information, recognizing assumptions, probability, and Venn diagrams. So use your whiteboard and pen as much as possible. Diagrams can help you sort information. Maximize your efficiency, commit to diagrams and sorting information early. Simplify the question and data. Cut out any obvious wrong answers. Guess an estimate. So these are the question types we talked before: syllogisms, logic puzzles, Venn diagrams, probability, interpreting info, and recognizing assumptions. It's really important to know probability, not just for this section, but it also comes up quite a lot in the quantitative reasoning section. So you are killing two birds with one stone with the probability revision. So your approach for decision making: use your whiteboard, write down key info, don't skim the text, and make no assumptions. So suspend your own logic and beliefs in order to reach strongest conclusion. Brush up on understanding of basic maths and charts. Read each question carefully and focus on the relevant knowledge or information. Use your paper to help sort out the information. Draw or write things down to help you visualize a conclusion. Pay attention to the vocab used: all versus most versus some. Consider rounding numbers. And revise probability. A lot of students do find this tricky. If you go back to GCSE, I'm sure that you'll remember probability trees. I don't remember them anymore, but probability trees are quite an easy way of helping to work out probability. So extra resources. So UCAT Ninja, Training Temple, Practice Dojo, and Exam Arena. So currently full access is £1. So take full advantage of this, guys. It's a really good resource, has a lot of questions on it that will aid you in your UCAT preparation. So we also have 6 Meds 2-day UCAT crash courses, which I do actually help to run. The next one being on the 22nd, I believe, of July, 22nd to 23rd of July, where you get a more in-depth presentation to what we've gone through today. And it's over 2 days. So that's also an option there on the website. You've got one-to-one UCAT tuition as well. So we do offer UCAT tuition, and I'm also a tutor. So you might see me again if you do choose to go ahead with that. And that's all the information for the hours and stuff is also on our website. And the UCAT website in general, just for advice, mock papers and practice questions. So their mock papers are made by the UCAT people, so probably the most representative of the actual exam. However, I would also suggest saving those to be some of the last mock papers that you do. And also for attending this today, we've got a discount code for you guys. So it's E8K6GPGX. And if you use this coupon at checkout within 75 hours of this course, you'll get 5% off any 6 Med product. So thanks, guys, for attending today. It was absolutely lovely to meet you all and answer all your questions. I really enjoyed teaching you. And good luck for your UCAT. I hope it all goes really, really well.